tell us a little bit about yourself and what you do at Kingsbridge.
So I am a theatre equipment coordinator. I have been working here for 8 years now, and I was in theatres before that as a deputy theatre manager.
And what did that role entail?
The deputy theatre manager, so the daily run of the theatre, ensuring safety and efficiency and delivering the best possible 5-star quality care to the patients.
And would you have to look after all the different instruments and things and the staff? Or?
Yes, so my role predominantly is scrub nurse, so assisting the surgeons throughout the operation, but then I also do anaesthetics and the recovery role as well, so interchangeable.
And how did you get involved then with this project in Pakistan?
So I've worked with Mr. Hill, Chris Hill, for numerous years, 10 years plus now, and every year he would come back from Pakistan and show us pictures and talk about all the clefts, all the wee babies and the children that he'd operated on. And it's always something that I would really love to have done. My son is 10 now, actually, this month, so he was a wee bit too young at the time, and but yeah, that's how I've got involved with Chris talking about his experience over there.
And what is the name of the charity that you go out to this mission with?
So it's the OPSA, the Overseas Plastic Surgery Appeal. It's a charity that's based in Hull, and it was founded 25 years ago now by Nick Hart, who was the Cleft surgeon for Hull and the Yorkshire region. Nick has since retired, and he's still the chairperson of the charity. And it's a few trustees, Annette Middleton, who joined 24 years ago. She is a scrub nurse. And then Mr. Mohammed Riaz, and he worked with Chris years ago in Northern Ireland. And that's the affiliation with how Chris also got to go out to Pakistan.
And how long did you go for?
So the trips are 10 days between travelling and different things. Then you're working, well, for the 10 days. And that's October passes my 3rd camp. So it's my 3rd trip over to Gujrat in Pakistan, yeah.
And you think you'd like to go again?
Definitely. I think it's, once you go over there, the experience and how it makes you feel, you can't actually describe it until you go over, you know. It's just it's an amazing experience, and they're so thankful, and the warm welcome and just the life, it's life-changing, it really is, for the patients.
And what sort of life-changing things have you witnessed? Have you seen young people and young children and adults have a dramatic difference post-surgery?
Huge difference. I mean, the resources are so limited over there. You know, we are so lucky here, and we take for granted, myself included, because society nowadays, you know, that sense of entitlement and the health standard here is so high, and these patients, they don't know any different. But, you know, because of that, they're quite complex cases. You know, the children can present older, whereas here they would have been taken care of and dealt with a lot quicker because of all the prenatal scans and different things. Here, obviously, you know, that's not the case over there. So, I mean, they also have, although they're complex surgeries, there's a lot of comorbidities and a lot of other, you know, that factor into to the cases themselves. So, you know, you're dealing with cardiac issues, and you're dealing with maybe, you know, neurological deficits and stuff like that. So it's, you know, a lot of them just isn't a cleft. Some are, granted, but they're complex cases, and so they tend to keep those cases for Mr. Hill. And you know, they present then during the March and the October camps when the team go out.
If you were to put a number on how many people that you have helped over the last 10 years in those times you've been going, how many people do you think?
Thousands.
Yeah.
Mm-hmm. Yeah. I mean, that's 25 years of surgery. You know, Chris has been out there 13 years, I think it is, around that. You know, you're averaging anywhere between maybe 30 and 40 cases per camp, and that's twice a year. You know, so the numbers it's making a huge difference. It is. You know, my role initially as a scrub nurse when I went out, of course, remembering that I had never experienced, I went to the Royal Sick Children's in Belfast to see Chris operate because it was all new to me. And what I seen there, I thought I was going to see when I went out, but the shock, it was nothing like it. Yes, the skills, the tray, the instruments that I was, offered and assisting him in his surgery were the same, but the cases were so complex.
But the results were.
The results are amazing. They're life-changing, and the smiles on their faces, and on the mommy's faces and the daddy's faces, and they're so thankful and they're so grateful. And it's just I think you'll know even by talking to, you can't hide the fact that it's an amazing place. It's an amazing thing to do. It really is.
Tell us your name and your specialty and where you work.
My name's Chris Hill. I am a consultant plastic surgeon and I work in Kingsbridge Private Hospital North West. I also work in the NHS and work between the Ulster Hospital and the Royal Belfast Hospital for Sick Children.
And we were speaking to one of your colleagues and they were telling us about a recent mission that you had in Pakistan. Can you tell us a little bit more about that?
Yes, I go to Pakistan usually once a year with a small UK-based charity called OPSA, which has a very well established link with a little hospital in Gujrat in Pakistan. I'm going to say little, the population of Gujarat is 1.6 million, and this isn't even a big city. So I've been going there every year, and a couple of times twice a year for about the last decade, and to do cleft surgery. The hospital does all sorts of surgery, but there's a focus on cleft surgery, and the reason I wanted to do that was because cleft is my subspecialty interest in the NHS, and I wanted to try and sort of help a bit, but it's also about training. So I'm now good friends with two of the local surgeons who are now consultants who are good cleft surgeons now, and I've known them since we're trainees. So it's not just about going out and doing the surgery, it's about leaving something behind and about teaching.
And what exactly is cleft surgery? What does that entail? What type of patients would you see?
Well, cleft surgery is basically, most people will know what a cleft lip looks like, but there's cleft lip and palate, and about half the clefts don't involve the lip, they're cleft palate only. The important part of that is fixing the palate so that the child or adult can eat and speak. So the surgery involves repairing it, often in stages, repairing the lip if the lip's involved, and then repairing the palate. And it's very, very important because it's not just about appearance. If it's lip, the palate's really important in terms of communication. And if you can't speak properly, it stigmatizes you, it affects your education and employability. And so it's really very, very important that these are repaired well.
And how many people would you help on one trip, one visit?
Well, it varies. When I first went, I was doing mostly primary repairs, so fixing babies. But as they got to know me and I got to know the local surgeons, they now bring more complex cases. So maybe doing fewer cases, but they're more complicated. And they will save those difficult cases because the two local surgeons are very capable of doing straightforward cleft repairs and get very nice results now. But sometimes they will keep a case that they think is going to be challenging and they want me to do the case with them when I'm there, and I think that's really important. We're at the point now where these two guys can do, as good a cleft repair for a primary maybe that I could, but there are more complex cases that they maybe still need input with.
And are there any particular cases that come to mind that you could give us an example of, any particular patient?
Well, yeah, I mean, there are always patients, and the same thing in my NHS practice. So there's patients that stay with you, that you will remember for your whole life. And in Pakistan, there are two cases that I did a few years ago, but that I've been able to follow up and see as the patients they bring them back for review. And there's Zayn, who was a little boy who I first met a few months after he was born, and he had a very complex craniofacial cleft, and that isn't what those would normally be repaired in the UK in a craniofacial centre. And I sort of said to Riaz, who organised the trip, Riaz, this isn't what I do. And he said, well, if you don't fix it, it isn't going to be fixed, because at that point in Pakistan there was no craniofacial surgeon. So I fixed Zayn's face and his palate, and the good fortune to be able to see him grow up. But he has lots of other complex problems, but he is very loved by his mother, and so the surgery was very worthwhile. And the other patient that sticks with me is a girl called Maria, who I first met when she was about 10 or 11. And she, again, complicated. She had a serious cardiac defect, and as a result, she hadn't had all of the surgery for that, and no one wanted to fix her cleft. And the family couldn't really afford it either. So she had an unrepaired bilateral cleft, which you'd never see in anywhere in Europe now. Everyone gets your surgery as a routine here. So Maria had an unrepaired bilateral cleft, which was pretty complicated, and the big challenge there, in fact, was for my anaesthetic colleagues who are really taking much bigger risk, in fact, than I am, because the complex anaesthetic for a patient with a cardiac defect, and they've got very little backup. So I actually have huge admiration for the anaesthetists that come with us, because they're really being challenged to keep these patients safe and to keep the surgery safe. So at the team, I mean, every time I've been out with fantastic people who all want to do good work, and you're with a great team.
And if someone wanted to support that team in some way, is the particular charity, is there a way of fundraising for them or sending some funds?
Well, OPSA, Overseas Plastic Surgery Appeal, are a small UK-based charity. They have a website. They don't have any admin, so all of the money goes to funding these, what they call camps, to support this Cleft hospital. And we're also fortunate that the Emirates Foundation, the airline, give us our flights. So the charity is now not having to pay to get us there, which makes a huge difference. But everything costs money, and even when we're there, we're very well looked after. We have to be fed, and the local family that sort of set the hospital up have put huge amounts of their own money into this as well, and to keep this going. So I've seen it grow in the years that I've been there, and it's really quite a fantastic establishment now, the wee hospital. So.
And of course then you've given it of your own time as well, as did your colleagues.
Well, yes, but it's when I see the sacrifices that other people have made, for me to take 10 days a year to go and do this, is very little, and I'm very willing to give it, and I probably get more out of it than I can ever give. So, it's really worthwhile. And if everyone did a little, the world would be a better place. You don't need to do a lot, just a little.